This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
Welcome back, everyone. She provides so much insight in terms of keeping us healthy, understanding how our bodies work in so many different ways. She is the founder of Path to Wellness, and today we're going to dig back into our conversation about the heart. There's so much going on there, so much insight learned last time we got together. If you want to check that out, just do a search of podcast for us. Part 2 on the heart today with Teresa Wilkinson, who is back on. Hey, how you doing?
I'm doing fantastic. How about you today?
I'm good. I'd be better if I remember where we left off.
Well, we're always telling stories, so I'll start out with a story.
Sure.
What got me interested in heart, even as a nurse, was my dad was taking my niece back to Houston from Tulsa, and they got on the airplane in Tulsa. The next stop was Dallas as a connecting flight, and so it's only about 20 minutes. But anyway, he had a heart attack as soon as the plane took off, and it was the kind. So there's different types of heart failure, and this was the type where the circulation, the arteries to the heart were clogged. And needless to say, and he said from 1 to 10, 10 being the worst, it was, about 1,000 as far as heart pain, as far as pain in the chest and back and all that. And needless to say, they put him down in the aisle and laid him down with his feet up. And he said, no one got their snacks or drinks on that flight.
Because I was blocking the aisle.
He was blocking the aisle. And then, of course, they had an ambulance for him when he got to Dallas, and he went to a heart hospital. And so he had the best of care. So that was good. He he was in World War II in the Band of Brothers. I don't know if you've seen that movie or series.
Wow. Yeah.
And so his only post-traumatic stress situation was if he saw the sight of blood, he fainted. And so sometimes that was very inconvenient, but he had he was doing some carpentry, and some piece of wood fell behind his saw, and he looked down to pick it up, and a 16-penny nail gouged him in the eye, and kind of ripped the eyelid. And so I met him at the hospital, and he had, a rag over his eye, and he did just fine. And then, driving himself there, and then went right into eye surgery, and he didn't come back to the room. And this was several years before this happened. And we wondered, well, where is he? And they finally said, well, he's in ICU. He had a heart attack during surgery. So I guess he had kind of a delayed reaction to having that injury. But they just put him on medication at the time. And then he found out later that really the medication that they put him on really wasn't that beneficial for his situation. But they have improved in heart surgery and heart medication quite a bit since that time. That was early 70s. But so I took extra continued education in heart, and was always on hospital floors where they did heart monitoring and that kind of thing, since that was kind of a special interest. But my mother had a situation where she passed out walking around in the neighborhood, and completely passed out, fell flat on her nose, broke her nose. And so she had to really, we're in Tulsa, so I will say medicine isn't the highest I think we're number 50 in the ranked in the states for medicine. So anyway, she really had to push for a long time to get anyone to pay attention to her, that she really felt like something was wrong with her heart. So she had more of an atrial fib situation, the rhythm being off. And so she ended up going through some extensive testing eventually, and it turned out her valve, aortic valve, wasn't working properly. And so she ended up having a valve replacement. So she
Wow.
ended up with, uh, at that time, you had the choice of a metal valve or what they call a biological valve, which is actually a pig valve. So, interesting enough, they use pig a lot for replacement parts for us. And
Hmm.
so, I think probably because she was an old farm girl, the idea of having pig inside of her heart didn't seem appealing. And so she ended up going for the metal. And she had to be put on Coumadin, which is a blood thinner, which is actually rat poison. So they have to highly monitor you. So now they have better blood thinners
Wow.
um, that are much better, where they're safer. You don't have to be checked all the time. And so she had to go every week and be checked, and then they had to change her medication levels and dosages. And she eventually, at 82, very active, go getter woman, very unbelievable, outgoing, put a bank on the map, which takes collecting several million. So she really had one of these outgoing personalities, always won first place in selling Chamber of Commerce memberships, winning trips around the world. And but anyway, she died in her sleep, and I know it was a stroke from probably the coagulation, the blood thinner not working. So if you
Mm.
have heart rhythm problems and your heart's not beating properly, and it's kind of like beating eggs, that blood gets whipped up and it will cause blood clots, and then you'll
Ah.
throw a blood clot and it'll go to the brain. And
Yeesh.
so anyway, dad had a heart attack 2 weeks later. He was just heartbroken. They'd known each other since high school. So anyway, I knew he was in trouble because when I laid him down to do acupuncture, he turned blue. None of the doctors here would help him. They wouldn't do anything about it. And they said, just you're just going to have to go home. And I went to two different heart hospitals here. It was a radiologist that whispered in my ear, um, get him down to Dallas to Dr. Dewey at Medical City. And so he had local health care. The hospitals put out a insurance called community care, and it only serves the local hospitals. So I had to pretend I was the nurse at the doctor's office to refer him down to Dallas to get it paid for. Got him down there, and they ran all these tests, and they said, well, and what was interesting is at the end of the day, my brother showed up from Houston, and they thought my brother was the patient, not dad, because dad sat there so calm, cool, and dry. And I know it was because he had gone through World War II, he'd gone through so much, and he was just. He actually looked very young for his age, and my brother looked older, and so
Wow.
and so they thought my brother was the patient. Anyway, they told us, they said, well, we've done everything we can. We have one more test, but we're backed up a few months on surgery, and so you're just going to have to go home, take him home, and come back. And I said, no, he won't make it. I just know, because if he lays down and turns blue, he's in
Now,
some
why
trouble.
why was he turning blue when he lay down?
Okay, so when they did, they said we have one more test tomorrow, and when we do that, you'll have to go on home. But I was in the waiting room when they did that one more test, and they came running in, several of them, going, "We're so sorry. We're so sorry. You were right. You were right. He has no compression at all in his heart." So what they were doing is the last test was checking to see if they could run instruments up his artery, if his artery was big enough to run an instrument up to do valve replacements. And when they ran the instrument up and saw his imaging of his heart, they saw both valves, the main valves. There's four valves, but the two that they replace are the mitral valve, which is coming from the heart, or the aortic valve, which goes to the body, for sending blood to the body. And so he had none of the valves were working at all, and so he was definitely blue, sputtering, coughing, gagging, having a hard time even getting a breath of air. And they were apologizing up one side and down the other for missing it the day before, and that I was right. But it was just too obvious for me, when he laid down, that he turned blue. So I knew his heart was not functioning. And
Wow.
so, because it was such an emergency, they didn't even bother with going through the arteries like they do now. They go through the wrist artery to do the aortic, and they go through the femoral down by the leg in your groin area to do the mitral. And at that point, they said, "Do you want to do metal or pig?" And he said he wanted to do the pig because he saw what happened with mother and all the extra work it took to work with that Coumadin and keep the blood thinned at a certain level, and then what happened with her. So he went with the pig valve.
How long ago
And
was that?
so
Was that, Teresa?
this was 2008.
Wow. It's
So they
amazing
were
they were
they were just
doing that
testing
then.
it.
Oh, okay.
Well, this was under uh, testing. FDA was just checking it out. So that's why I had to go to this particular doctor in Dallas that was doing those uh, the testing to see how well it worked. If they were able to, FDA was able to approve it. So it was
Isn't it
still under.
amazing that the advances? My friend, my best friend's an EMT, and he recently transported somebody who had or was having a stroke, and they allowed him in the emergency room area to watch the procedure. Femoral artery, send a wire up there inside a tube, and
Yeah.
very fine, all the way up into the brain. The hardest
Yes.
part, before I get to what happened when I got to the brain, the hardest part, according to the doctor, was the way the arteries were up, like by the neck and up, going up toward the head, was it was kind of like a loop. And the doctor
Yeah,
said,
wiggly. Yeah.
he's like, that's the challenge where I got to go down, I got to go back up again, but got it up inside, and they were able to, through the tube, and the wire serves another function, through that tube, pull the clot out. So all that trip down to the leg, my friend's like, bloop, right there on the table, bloop, that was the clot, comes out. We're all good. Amazing. Amazing what they can do.
Yes, that is pretty amazing that they were able to articulate going around that loop, because the art that's the thing, is the veins not always are straight.
Yeah.
So on the when they used to do the bypass, which I think in some situations they still have to do the bypass surgery, um, uh, on some people they will have to take at least two strips out of the legs instead of one to find a straight vein that they
Mm,
can use. So that was one of the reasons they wouldn't do it here in Tulsa and help him, is because he had already had open heart and they didn't want to go in a second time.
oof.
But I talked to a travel nurse during COVID that did cardiac around the United States, and she said it's very common to go in a second time with open heart, that is not that big a deal. So that just shows you how inexperienced the doctors were here in Tulsa, well, I had to take him to Dallas to where they were
Wow.
more experienced and that they could do that.
Geez.
But during COVID, my brother, I noticed, was coughing and gagging every time I talked to him. So I called him every morning, check in, and he was always hacking, hewing, snotting, gagging, blowing his nose, hacking all the time. And this went on for, God, it was going on for a year. And I kept telling him, you have got a valve problem. You've got to get your heart checked out. Because what happens is when your valves don't work, there's a backflush, and that backflush goes back to the lungs. Then the lungs come back up, so
Oh,
then you have congestion in your lungs, just like if you have a real bad cold or flu. And so that's a big sign for people if you have continued coughing and gagging and uh, production of sputum, you may have to really check into that heart. If you get over, say, of course, allergy season, that might happen, cold or flu, that might happen. But if it persists over a long period of time, you've got to start looking into the fact that you may have a valve problem with your heart. I
wow.
bugged him for a year and he would argue. And I don't want to sound prejudiced or anything, but sometimes men are more hard headed than women about going to the
Oh my gosh,
doctor.
I'm right there
You
with
know,
you.
I'm fine. I'm fine. And the day I finally, I was going into work and I finally gave up arguing with him. I said, okay, whatever. Well, after I got off work, I called his wife and I said, would you please take Stan and drop him off at the hospital? Because during COVID, you know, you couldn't stay with him. You could just drop him off. And so she said, I just dropped him off. And I thought, oh, thank God, he finally figured out. So his response now is, I just finally realized it wasn't going to fix itself. I
Mm,
finally realized it wasn't going to fix itself. Like it wasn't going to, I wasn't going to get over this. And it turned out it was a aortic valve, which usually that kind of symptoms is more the mitral valve because the mitral valve is the one that comes from the lung to the
lungs.
heart,
Wow.
but it was actually the aortic that was calcified. That's the most common that will calcify on you. And I think we talked about that K2, K3, or that K2, MK7. It's the same thing, but it prevents calcification of calcium on your heart valves or creating kidney stones or spurs on your bones and that kind of thing. So that's one of the big things. It's real important for your heart because most vegetables, the cruciferous vegetables, greens, have a high amount of calcium in it, even if you're not taking a supplement.
So,
And usually,
question on that. And the calcium test is one of them for the heart, where they can identify that you have calcium within your heart. What are your thoughts? We're just about out of time, but this has been, I'm seeing more about this. More people I know have been diagnosed with an amount of calcium in their hearts, and now they're on statins because of it, and family history. What are your thoughts there?
well, we have talked about statins, and that's where I go back to taking this K2, K3. The statins cause severe problems with the legs. If there's any way you can work with diet and exercise and take some supplements instead of because of the muscle spasms, um, MS symptoms, restless legs, all the things that statins do. And also, we talked about the brain. It also causing dementia and Alzheimer's because you're lowering that cholesterol level to your
Mm,
brain. So I had a patient that said, well, every time I try to get off my statins, I go through depression. And so we talked about the L-DOPA, and I think we talked about that before. It's a powder. You can get 99% L-DOPA through Amazon. And he started doing the L-DOPA, and that prevented the depression. So he was able to wean himself off of the statins. But I had a lady in the other day that thought she was having a heart attack, and she says, I've been sick with a sinus and cold flu for about a month. She said it's just been going on for a month. This hacking and coughing and hacking and coughing. And I said, and so I went to the doctor because I thought I was having a heart attack. I said, why did you not ask for a Z-Pack and some antibiotics? You know, because you were sick
Right.
for a month. And she goes, well, you can only ask for one problem or you have to pay extra. And I thought, I don't know. That's not true with my doctor, but it must be with some if it was with a company or something. But anyway, she
At,
had
at this point, we're almost out of time. I don't even want to get into the insurance
so
situation.
so anyway, so what I told her, I checked her all out, did her vitals, checked everything. But anyway, bottom line is her birthday was the next day. I said, you're not having a heart attack. You're just having another birthday.
Oh, I remember that one. Wow.
Well, we'll end on that one.
I love your insight and how it's just practical and easy to understand. A lot of times, I'll watch something, hear a podcast, I check out. I was like, I don't even know what the heck they're talking about. It just, now this is real. And I love the progression of medical technology, as we were talking about, even back in '08, what they were doing. Just
Oh,
amazing.
plus they're combining metal with pig now. They do the metal sheath with a pig inner, and then that way, if the pig fails, they can slip another pig valve in that
Oh,
sheath
wow.
and keep you going. And
I
so they've
remember
improved on the valves even more.
my mom, when I was a kid, always used to tell me, I don't know how much truth this is to it, but if you need stitches, they get them from cat's gut.
That's right.
What was that true?
That's true.
Back in the day, though.
Well, I think they still do to some degree.
I don't even want to know. Tulsapath.com is your website. You're fabulous. Thank you so much, Teresa, for being here today. Also, happy Thanksgiving.
Yeah, happy Thanksgiving to you too.
I appreciate
Look
it.
forward to talking to you again.
Yep.
Okay.
We'll
Have
talk
a great
soon.
one. Okay.
You too.
Take
We'll be
care.
right back.
Bye-bye.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.